Hello everyone. Today we are going to discuss about brain abscess. So in my previous video, I have discussed the diffuse infection of the brain like meningitis, meningoencephalitis and encephalitis. Now I am going to discuss about the focal infection of the brain, that means the brain abscess. Brain abscess means infection in the brain parenchyma. Focal infection of the brain parenchyma is called brain abscess. Now the most common etiology. The most common organism which causing brain abscess is Streptococcus miliary group. That means Streptococcus miliary group is the most common organism causing brain abscess. Among the Streptococcus miliary, the most common organism is Streptococcus aeruginosus, and after that Streptococcus intermedius, and staph is the second most common organism which causing this brain abscess. If a child having ventricular peritoneal shunt, and the most common organism causing brain abscess, if the patient having ventricular peritoneal shunt is also Streptococcus miliary, and after that gram-negative organism is the second most common organism causing brain abscess. So, if the patient having ventricular peritoneal shunt, always think about some brain abscess due to gram-negative organism also. If the children is immunocompromised, then most common organisms are also Streptococcus miliary group. After that, there is a nocardia, listeria, or fungal infection. 80% of the brain abscess is mainly occur in the frontal, parietal, and temporal lobes, and the less 20% is mainly affect the occipital lobe, cerebellum, and the brain abscess. Now we will discuss about the predisposing factor of brain abscess. That means where from the brain abscess occur. That means the virus, where from the virus come into the brain parenchyma. So the most common predisposing factor of brain abscess is if the child having meningitis. Then this is the most common predisposing factor of brain abscess. Then the virus or bacteria from the CSF itself get attached to the parenchyma and causing this type of brain abscess. After that, if any patient suffering from otitis media, mastoiditis, sinusitis, or any soft tissue infection in the scalp, then this virus can get a chance to infect the brain parenchyma. After that, if there is penetrating injury, head injury, then this may be a predisposing cause of brain abscess. Or if child is suffering from congenital cyanotic heart disease or congenital heart disease, if the child is suffering from endocarditis, these are all always a predisposing factor of child having brain abscess. So if you found a patient having brain abscess, always think about the predisposing factor and search for the predisposing factor before treating the brain abscess. Because this predisposing factor, if we do not search the predisposing factor, then the child may have brain abscess recurrently. So always search for meningitis, always search for any otitis media, or search for any VP shunt present or not, congenital heart disease or endocarditis if a patient having brain abscess. Now come to the critical feature. The most and foremost critical features is the fever. So child always have fever. The child suffering from low grade fever, after that there is a high grade fever, and along with the fever the child having vomiting and headache. Headache and vomiting is comes simultaneously, because if there is a brain abscess present in the brain, and this abscess there is a after when the abscess is formation occurred, there is a inflammation in the brain parenchyma, and this inflammatory product stimulate the vomiting center and causing projectile vomiting, and also this uh, brain abscess causing a pressure effect to the brain and causing severe headache. The child may be suffering from stroke, or the child may be suffering from convulsion seizure. So always these are the complications, these are the critical features of brain abscess. Now, if you suspect a patient having brain abscess, then always do a always do a imaging study as early as possible, because the imaging study is the diagnostic investigation of choice to diagnose brain abscess. So the investigation of choice to diagnose brain abscess is MRI brain with gadolinium contrast. So gadolinium contrast with MRI brain is the investigation of choice. So what we will found in MRI, we found MRI in ring enhancing lesion with peripheral edema. With perilesional edema with ring enhancing lesion and containing In the brain lesion, there is a containing of fluid, or there may be a chance of we found some gases in the brain abscess also. If the child is suffering from fungal brain abscess, then we found multiple air and fluid in the brain abscess area. In gadolinium, we found there is a ring enhancing lesion, and in contrast, we found a ring enhancing lesion with hypodensity, and there is a surrounding perilesional edema also. And this perilesional edema causing brain headache, vomiting, and also there is a pressure effect causing brain herniation also. So diagnosis of choice is MRI brain with gadolinium contrast. Now come to the treatment part. So empirical antibiotic to treat the brain abscess is we have to give ceftriaxone, metronidazole, and vancomycin. As because why these three antibiotic is given simultaneously, because ceftriaxone is to treat the Streptococcus organism. If the child having beta lactamase enzyme positive and beta lactamase resistant Streptococcus, then vancomycin will work, and metronidazole is given to rule out any anaerobic infection, because in brain abscess there is an increased chance of anaerobic infection also. Why? From this anaerobic infection comes from the dental caries or orbital cellulitis or otitis media or VP shunt. So these four predisposing factor, the child is suffering from anaerobic infection. So to peel out the anaerobic infection, brain abscess, we have to treat the child with metronidazole. So in case of brain abscess, we always give ceftriaxone, metronidazole, and vancomycin simultaneously. Now the duration of treatment. The duration of treatment is for 6 weeks of antibiotic. If the child having brain abscess with VP shunt, then the drug of choice is empirical antibiotic of choice is giving meropenem, metrogyl, and vancomycin. Meropenem is given to kill the pseudomonas and the gram-negative organism. We can add instead of meropenem, cefepime we can give also. Brain abscess in a neonatal period. Then always think about Listeria bacteria, and the antibiotic of choice is ampicillin and gentamicin. If the child is immunocompromised, then empirical drug of choice is ceftriaxone, metrogyl, vancomycin, and amphotericin B to kill the fungus. Now, what are the indication of aspiration? Only aspiration of the brain abscess is done in these four cases. First is if the diameter of the abscess is more than 2.5 centimeter in diameter. If there is a multilocular abscess for present. If this abscess containing gas, or if there is signs of intracranial compression or abscess is located in the posterior fossa or cerebellum, then there will be a chance of brain herniation. So we have to aspirate the abscess. So these are the four indications of brain abscess. Thank you.